All right, good morning, everybody. This is Heather Thomas in the Joint Information Center for Snohomish County's response to COVID-19. I want to thank you for joining us. I'm going to take just a moment to click buttons to make sure that all of you have permission to record. As always, you will have permission to record. We're also recording, and we'll make that video available on our YouTube channel and the Health District's website later today. Give you just a minute. Okay, I think I've given everybody permission to record, but if you run into any issues, please send a message to the chat box to the Joint Information Center, and I'll get that fixed. We're joined this morning with Snohomish County Executive Dave Summers and Snohomish Health District Health Officer Dr. Chris Spitters. Each of them will share some remarks, and after they've completed their remarks, we will take questions using the chat feature. Please make sure to submit your questions to everyone so that all of our speakers can see. I also want to give you a heads up that we do have a hard stop this morning at 10 o'clock due to another commitment, so we will need to wrap up by then. And with that, I will turn it over to Executive Summers. Thank you.
Thank you, Heather. Good morning, everybody. Good to see you all. Really great news that we continue on the downward side of the Omicron surge that we just all experienced. And it's really amazing over the last 2 months, really the commitment in Snohomish County by our residents and the businesses to really keep up the preventive measures has really kept the virus from spiking as high as it could have. Our hospitals did get right on the edge of becoming overwhelmed, but the death rate was not as high as in previous waves. So we avoided the really serious situation of just healthcare services that were totally overwhelmed. Very close, but we got through it okay. And hopeful now as we come out of this, our small businesses can start to thrive again. And I think this is kind of how we can expect COVID to look in the future if we have future waves of this and variants. So as we go into the future, some people will want to and need to continue to wear masks. I think the vulnerable with underlying health conditions, elderly, if you're sick, it's actually quite common in many parts of the world for people when they're not feeling well to wear masks in public to protect others. So I think that will hopefully become the new norm for us so we can prevent future surges or at least mediate them. There'll be a need in the future too for boosters and additional vaccinations, so we'll need to be wary of that. And people should still in the future isolate when they feel sick just to keep the disease from spreading. So we know what a serious outlook looks like. We've handled it well. I'm so proud of Snohomish County residents and everybody for working with us and working together to make this not as bad as it could have been. It's still a serious disease. My own family lost a dear family member just yesterday back in the Midwest to COVID, and we have another family member suffering for weeks now here locally, but will likely be okay. But it's a serious disease. But as we come out of it, we're hopeful that spring is near and coming, and we can get on with things, but be ready if there are future surges to step our efforts back up again. So with that, I'll turn it back to Dr. Spitters. Thank you.
Okay, thanks, Executive Summers, and good morning, everyone. I have a couple of brief updates today. First, on our numbers, you may have noticed that we didn't have updated weekly stats on our website due to the state's data system having a breakdown yesterday, and that's where we get the information to populate that with. So we did get that resolved early this morning, and you should see those numbers pop up on the website later today. What they'll show you is that we saw a further decline again, about another third reduction off the number of cases reported last week compared to the prior week. So up at the peak, we were up around 16,000 cases a week about a month ago, and now we're down to 3,500 cases for the week ending last week, and a corresponding reduction in the rate per 100,000 per 2 weeks. That rate figure that is currently now at about 1,000. And so although the trajectory is fantastic and new hospitalizations also are decreasing, and the hospital census, the number of people in the hospital with COVID, has also come down about 50% off the peak. The absolute level of, there's still about 100 people in the hospital with COVID, and our rate right now is still double the previous high during the pandemic. So trajectory is great. But it's still, we're still at a relatively high level compared to historical norms. We look forward to that continuing to come down, and then hopefully sort of peeling back some of the restrictions and requirements associated with COVID, but also with, as Executive Summers mentioned, with an open eye on the future, that we don't know exactly what's going to happen, and that we all need to, be ready to exercise common sense around the various prevention measures, whether it's vaccination, masking, distancing, what have you, that us as a society being able to come into and go out of efforts like that to mitigate the impacts of the current and future wave is going to be key to us all getting through this. As was announced Friday, free KN90 masks are now available at your local library. This includes all branches of the Snow Isle Libraries and Everett Public Library systems. Our libraries have been a tremendous partner throughout the pandemic, and we appreciate them stepping up yet again to help in this mask distribution effort. Some people may be wondering why free masks are available now when there's talk of mask requirements ending. Put simply, they haven't ended yet, and we want people to continue wearing the best quality masks they can get their hands on, and we have these available, so there they are. And while mask requirements are likely to be downgraded at some point in the near future as the Omicron surge further wanes and gets us down to a case rate and hospitalization levels that are really, further out of the woods, people will still need to wear masks even after that point when completing isolation or quarantine, as well as when they're in particular settings like healthcare, homeless shelters, congregate settings, that sort of thing. This will also be true for medically vulnerable individuals, like Executive Summers mentioned. And so just keep an eye on that. And remember that until changes are made by the Secretary of Health or the governor, the health district recommends and the local health officer's order requires that residents, employers, and organizations continue to follow those state requirements. So please take the opportunity today to upgrade your mask for free and stop by a local library. For more details on that, please visit www.snowhd.org/masks. With that, I'll turn it back to you, Executive Summers.
Thank you, Doctor. Any questions this morning in chat? Any questions? All right. What advice do you have for the governor on his decision this week regarding masks? Doctor, do you want to start?
Well, certainly what I think most important is what his staff advises him. I have great respect for and trust in the medical leadership of the State Department of Health, and trust that they will provide the governor with a thorough and sufficient situation analysis and projections of where things are going, and for the governor to make the best choice possible to protect health and keep society rolling. Having said that, as I mentioned earlier, whatever the the details of that policy evolution or shift are as we come down off the Omicron wave. I think it's important that we all just keep in mind that that's not a one-way switch, and that common sense should still dictate, and there can and likely will be times where it would be advisable to continue wearing masks. And frankly, it's quite possible that as a public health community, even though masking is not required, for some additional time, it's possible that we'll recommend that nevertheless, even if it's not required, continue wearing masking indoors into the future, or be ready to put them back on if we have another wave, whether that's 6 weeks or 6 months down the line.
Okay. As the state prepares to downgrade restrictions, is the county prepared to make any of its own restrictions if our local case rates require it?
Well, certainly it's within our powers and duties to do so. You may recall that just a month ago, I rescinded our local health officer order for indoor masking, deferring to the state, the Secretary of Health's masking requirement, and deferring to state guidance and requirements on all other matters COVID. I think it's very important that in a region that's as tightly knit as we all are, that harmony across counties is a good idea. Certainly, the local health officers are in discussion about what the best approach would be in trying to advise our counterparts with the state, who are interacting with the governor and state leadership on these matters. So, my tendency and preference is to harmonize and trust that the state guidance will be logical, prudent, and appropriate. If for some reason we felt that there was a great disconnect between what's happening here in Snohomish County and what's required of the state, we certainly would take that into consideration.
So it's now been a year since some people got their first shots. At what point might boosters be needed to be considered fully vaccinated?
Yeah. That is, science, the pursuit of the truth, which there are things we don't know yet. And I think that's one of them, is what is the long-term plan with respect to trying to maintain population immunity and individual level protection against severe disease. And again, I think a key thing is our marker is preventing severe disease, hospitalization, death, et cetera. And, I think that really remains to be determined. There's, for the long term, there among vaccinologists and immunologists, there's some concern about, the feasibility of continuing to chase strains, as opposed to ideally we develop a vaccine that's sort of induces an immunity that's independent of mutations in the spike protein. And that's certainly something we all look forward to, and that hopefully is in our future, so that maybe we could get a dose or two of that and be good for life, or good for a much longer period of time. Right now, it seems that boosters provide good protection against hospitalization and severe disease for 4 to 6 months. What the interim plan is remains to be determined based on experts, people doing the research, the regulatory body with the FDA, and the clinical recommendations that come from CDC. So that's all to be determined.
Doctor, the information I've seen is that the boosters that have been approved have been shown to be effective and more effective than not having a booster. So it is a recommendation currently to get the booster to be considered fully vaccinated.
By all means, Executive Summers, and that's, we want people to be what's called up to date. So not only have their primary series done, but have, if eligible for a booster, to have received that. and and then we'll see what recommendations are for the future. Could this be an annual thing, or maybe driven by waves or new variants? That all remains to be determined, but we urge people to get as up to date as you can for yourself now, and be open to and aware of recommendations as they change in the future.
Are we expecting any impact or rise in cases due to the stopping of masking outdoors and at large outdoor gatherings?
Well, never say never, but it seems highly unlikely to me. I think that's why the restriction was lifted, is it's a very low risk situation with a relatively high level of population immunity, at least for the time being, after this Omicron wave. Between that and prior waves and vaccination, fairly high level of immunity, infinite space when you're outdoors of dilution of the virus, better air movement. So I would not expect negative consequences from that.
How long is the county prepared to operate its vaccine locations as we move into what Governor Inslee is calling a transition out of the pandemic, especially with the expectation that more boosters may be required to keep people safe?
Well, the vaccine operations of the health district are part of the emergency response. And so both in concept and in financing, they're driven by the emergency response. And, I can't put a specific date on it, but the clinical aspects of the COVID prevention and control efforts that the health district has been participating in, namely testing and vaccination, ultimately are going to transition back to the healthcare system. Is it possible that we would need to stand those back up again if there were a big wave or a variant that merits doing so as part of, again, another emergency response? Well, then by all means. But for the long haul, I think we're going to be transitioning those clinical services back to the healthcare system, and more and more as time passes, folks will. Most people do get their testing and vaccination through the existing healthcare system, and it's that small piece of the pie that we do cover that will, need to transition back to the healthcare system.
Governor has said that he's considering dropping all masking indoors as well, possibly by next week. Any thoughts about that, Doctor?
Well, as I said, the trajectory is fantastic and hopeful, and I think we're headed to a good place. I don't think we're there yet. And, the governor has been tremendous in leading us through this and supporting public health, both in principle and financially. We're super grateful. And I, my sense locally, though, is that, there's a saying, you can ruin what was almost right by rushing to the finish. And I think we might not quite be there, but I have reason to believe that the governor's aware of that too, and that his recommendation or policy action will reflect that reality.
Yeah, I just want to add that I fully support that also, that we're watchful and we're hopeful. It seems a little premature to end all mask restrictions, particularly indoors where we know it's easier to transmit the virus. So, but we're taking baby steps, watching the numbers, and very hopeful. So I support a cautious approach also. Any other questions?
We'll give a last call, give folks 30 seconds. All right. Looks like we got through all the questions, so we'll go ahead and wrap up a little early today. I want to thank you all for joining us today. Please stay tuned for future media availabilities. Have a great day.
Thank you.